and meet their bottom line and hopefully turn a profit so that they can help grow our community. So I'll yield back my time now, Mr. Speaker. It's been a pleasure talking about the danger of repeal and the importance of the Affordable Care Act.
The gentleman yields back. Under the Speaker's announced policy of January 5, 2011, the Chair recognizes the gentleman from Georgia, Mr. Gingrey, for the remainder of the time this evening, approximately 26 minutes.
Mr. Speaker, thank you for giving us the time, and in fact we are very appreciative on our side of the aisle of having this opportunity this evening, Mr. Speaker, on really a historic day in which we finally delivered to the American people a promise that has been made over a year ago, that should this bill, this comprehensive health care reform bill, sometimes referred to as Obamacare, but more formally known as Patient Protection and Affordable Care Act of 2010, should this legislation pass, that if we had the opportunity to take control of this House of Representatives to get that gavel away from former Speaker Nancy Pelosi and the prior Democratic majority, that our first and #1 priority on behalf of the American people would be to repeal this mistaken bill. And today, Mr. Speaker, is the day that happened. And certainly I am extremely grateful as co-chairman, along with my colleague Tim Murphy from the great state of Pennsylvania. Dr. Murphy and I co-chair the House GOP Doctors Caucus. And, Mr. Speaker, we grew our strength in this election November the 2nd. We had about 11 members in this caucus, 11 very active, hard-working members who practiced medicine in one form or another, one specialty or another, for many, many years. In fact, I think, Mr. Speaker, at one time we calculated the number of years that we have actually practiced medicine, and it was something like 350 years of clinical practice. As you notice, Mr. Speaker, there's a little bit of a grayness around the temple of some of us, but we are very thankful for this election and the American people giving the Republican Party the opportunity to right this wrong and to bring 7 additional members, 7 additional health care practitioners, again, some of them having practiced for many years, dentists, doctors, even some associate members of our group, some registered nurses, to be part of this new majority. And as we voted today on H.R. 2, the repeal bill of Obamacare, I can assure you that 100% of us, in fact 100% of Republicans, all 242 on our side of the aisle, plus I think 3 or 4 Democrats in a bipartisan way, join with us in voting to repeal this bill. I realize this evening, Mr. Speaker, that our time is limited. I am very pleased that some members of the House GOP Doctors Caucus are with us. I would first like to take the opportunity to yield to my co-chairman, Dr. Tim Murphy of Pennsylvania. Dr. Murphy.
Thank you, Dr. Gingrey. Appreciate that. Let me talk about a couple of the important aspects of this bill and understand that if you have a car and it has a flat tire, you don't get rid of the car, you change the tire. But if you have a car with a great tire and the car is not running and it's broken down, you get a new car. And what we have here is a health care bill that indeed does have a few pages and some parts that we all agree on, and we want to work on those together. However, there's also thousands of pages of other problems and tens of thousands of pages, perhaps 100,000 pages of regulations yet to be written by boards, panels, and commissions yet to be appointed on issues we yet to know what is going to be included in this, and that is part of the reason why employers are frightened about what may be in this bill, and members of Congress shake their heads and say, how could something so massive, and it's going to cost over $1 trillion a year to administer this plan, how could this happen without Congress really having oversight? Let me mention 2 brief areas of this which I'm deeply concerned about. We know that one of the ways that we can provide better care and ultimately save a lot of money has to do with disease management or care management. This is when perhaps nurses or other specialists within the doctor's office or working with the hospital work to stay in touch with the patient. Patients who have asthma or diabetes or heart disease or other chronic illness, because they know if they can get that patient to follow up on their medications, their treatments, their therapies, they can prevent problems from worsening. They can help make that patient better. They can keep that patient out of the hospital. In the area of mental health, chronic illness has twice the incidence of depression when it's not picked up, and when depression is present and not treated, costs double. Now, unfortunately, this bill not only doesn't pay for this, but it cuts funding in an important area that did pay for it, and that's in Medicare Advantage. This bill, in order to try and pay for it, cut $500 billion worth of Medicare. And a significant portion of that was in something called Medicare Advantage, which covers millions of people, 7.4 million seniors in the country. One of the clear, distinct advantages of Medicare Advantage is it provided this disease management. Here's a couple of examples. University of Pittsburgh Medical Center found that they could reduce rehospitalization rates for diabetics by 75%. Another hospital in my district, Washington Hospital, reduced readmission rates for heart disease by 50%. Another plan reduced asthma readmissions by 28%, all by doing this important care management. Well, unfortunately, if you like the plan you have, you can't keep it, because this bill guts that and eliminates that portion of it. And out of this 2,900 roughly page bill, to have a couple sections that people are talking about as the benefits of why we should keep this bill, these are areas we agree on. Maintain pre-existing conditions coverage. Don't cut people because they're sick. Let kids stay on their parents' policy for a little bit longer. All important parts and things we will continue to work on as a conference, because we understand health care. And in particular, this caucus made up of health care providers. We work with patients for many, many decades altogether, hundreds of years, and we understand the bottom line is we must work on health care reform, and this bill quite doesn't reform that. So I yield back to the gentleman from Georgia, and thank you so much.
Dr. Murphy, Mr. Speaker, I thank Dr. Murphy for his remarks, and now I would like to yield time to my colleague from the great state of Georgia. I represent the 11th District. He represents the 10th District and in the Athens area, and a great friend of mine, a family practitioner, Dr. Paul Brown. Dr. Brown.
Thank you, Dr. Gingrey. I really appreciate your doing this special order tonight, and I've look forward to this opportunity. We had a great fun in the last Congress talking about how bad Obamacare is, and I'm excited that today the Congress, the U.S. House of Representatives, voted to repeal it. Now, I may ask, in fact, I was on Neil Cavuto this evening, and Neil Cavuto played some tapes or speeches of our Democratic colleague and said, we've heard over and over again that Republicans don't have anything to offer. We heard last Congress that the Republicans are the party of no. Well, we are the party of KNOW because we know how to lower the cost of health care. We know how to provide good quality health care at the lowest price, and we know how to create jobs and create a strong economy. And those are the things that we're going to be doing in this Congress with a Republican majority. So I'm excited. But where do we go from here? Well, yesterday I introduced my bill, one of two that I had in the last Congress. I reintroduced one yesterday. The new number is H.R. 299. And what it would do is do five things. Number one is it would repeal Obamacare if it's passed into law. Number two, it would allow people to buy health insurance across state lines, which is a constitutional thing. Actually, we should, under the Commerce Clause, expand commerce. That's what the original intent of the Commerce Clause is, and so that's what my bill would do. Thirdly, it would allow anybody in this country, business individuals, to join an association so that they could join a huge pool. And this would mean that they would have multiple insurance products that they could buy at a much lower cost than they're paying today. The fourth thing that it would do is would stimulate states to set up high-risk pools. Many states have already done that very successfully. And then the fifth thing is it would allow everybody to deduct 100% of their health care costs off the income taxes, which would markedly change the dynamics of health care financing. I introduced that last time. I introduced it yesterday. My other bill, the Patient Option Act, it was H.R. 3889 in the last Congress. I will be reintroducing that. But our colleague from Georgia, Dr. Tom Price, who at the time was the RSC chairman, introduced the RSC bill, H.R. 3400 in the last Congress, which was the RSC's bill to reform health care financing. We've had multiple bills introduced. Why has nobody heard about these things? Well, because Nancy Pelosi has operated in a very dictatorial manner. She didn't want our bills to ever see the light of day, and neither did the mainstream media. But I think you're going to see these bills come forward. We need to repeal and replace Obamacare. Obamacare itself is going to destroy jobs. It's going to destroy budgets. It's going to destroy the quality of health care. It's going to destroy jobs. We just had our friend, Democratic colleague Keith Ellison from Florida was just here talking about how repealing it would hurt small businesses. Well, the simple truth is that keeping Obamacare is going to hurt small businesses. I've talked to a lady, small employer. She has right now today 8 employees. She desperately needs to hire some more, but she's not going to until we repeal Obamacare because of the financial strain it will put on her business. It's going to break the budgets of every state in this country with increased Medicaid. We've got to repeal Obamacare. We've got to replace it with something else that reduces the cost, not just slows the cost, but reduces the cost of every health care service and product in this country. And we can do that. My bill will do that. Other bills will do that. And Dr. Gingrey, we're going to repeal and replace Obamacare. We're going to put it out for the American people to see so that they know that the Republican Party is the party of KNOW. We know how to solve these problems. I'll yield back.
Reclaiming my time, and I thank the gentleman from Georgia from the 10th Congressional District. And the gentleman makes some great points. And colleagues on both sides of the aisle, I would ask you to look at the posters that we have here, because what Dr. Murphy, Mr. Speaker, and Dr. Brown are talking about is really the plan. And the plan is not a plan, but it's a series of plans, if you will. It's a Plan A, it's a Plan B, and it's a Plan C. And, of course, today the repeal, as depicted on this very first and second poster, was at least the House completion of Plan A, and that is repeal of Obamacare, as this poster depicts. Priority number 1. We feel very strongly that that's what we need to do, and that's what we did in this House today. As Dr. Brown was talking about, Republican priority number 2 is not only to repeal it, but to replace it, because every one of us, particularly the members of the House GOP Doctors Caucus that are on the floor this evening, understand that that nothing is perfect. And as Dr. Brown and others have said, we tried to bring forth legislation during the 111th Congress. We gave a copy of Better Solutions to the President, Mr. Speaker. Page 8 and 9 was all about our plans and other options other than a government takeover, lock, stock, and barrel of the health care system. The President said, well, I got it and I read it, and then went on to say they have no ideas. They won't bring me any ideas if they only would. So priority number 2, of course, replace Obamacare with reforms that empower patients and protect our economy. And then, of course, as I say, Republican priority number 3 in this poster, repeal and defund provisions of Obamacare until full repeal is successful if we're not able to get the Senate and the President to go along with us in regard to this full repeal. If they don't do it, quite honestly, they're not listening, Mr. Speaker, to the American people. And I think they do that at their own peril.
The gentleman yield for half second.
I will yield back to the gentleman from Georgia for 5 seconds.
Well, I need a half one. The President told us and the American people, if anybody has any other idea besides Obamacare, his door is always open. I know I knocked on his door and nobody was home. They didn't answer the door as they have for other members of our caucus.
And I thank you, Mr. Speaker. And at this time, I would like to yield to one of our freshman members, the gentleman from Arizona, Dr. Paul Gosar. Dr. Gosar is a dentist and has been very, very active, not only in his own practice in Arizona, but in the American Dental Association. At this time, I'm proud to yield to a freshman member, our colleague, Dr. Paul Gosar.
Thank you, Mike. Thanks to my colleague, Dr. Gingrey, for acknowledging me some time. As a practicing dentist for 25 years, I've seen how government-run health care actually works. It doesn't. I've actually seen where what we've done is spilled over into the private sector, trying to laden the private sector with the liabilities from the public sector. What we've got to do is we've used creative accounting, taking 10 years of revenue to pay for 6 years of actual treatment. I don't know, as a practicing dentist and as a businessman, how that actually works in anybody else's terms. We also have to look back at our past to go forward. And there's 3 things I was always taught, is look at your mistakes, where you're failing, look at your accounts and your liabilities, and then make sure that you make an equal playing field. That's what we haven't done here. Where is the tort reform? Where is the liabilities and assets that we've had? And make sure that we're using those properly. And last but not least is increase the competition in the marketplace. True insurance reform, where we have insurance companies competing for us on the private sector as an individual on a patient-based center. I yield back the remaining of my time and thank very much the gentleman from Georgia.
Mr. Speaker, I thank the gentleman from Arizona and welcome him, of course, to the House GOP Doctors Caucus. Our final speaker, and I want to yield time to a cardiothoracic surgeon, Mr. Speaker, from Indiana, a new member, Dr. Larry Bucshon. And I think Dr. Bucshon, Mr. Speaker, was here on the floor a little earlier when the Democratic 30 minutes was controlled by the gentleman from Minnesota and made some remarks against the fact that we were successful in repealing Obamacare, and I think Dr. Bucshon would like to comment on some of those points that were made, and at this time I proudly yield to our new member, Dr. Larry Bucshon.
Thank you, Dr. Gingrey, for allowing me this time. Mr. Speaker, I was proud to vote for the repeal bill of health care today because as a practicing physician for 15 years, I know that the government approach to the health care reform is the wrong approach. It was said earlier tonight that why aren't the Republicans focusing on jobs? Well, I would hold, Mr. Speaker, that this is a jobs bill today. The health care bill, the Obamacare bill, is a job destroyer. I held roundtables for large and small businesses throughout my district, and I never heard any of the things that I heard earlier tonight in this chamber. What I heard is that it's preventing them from expanding business, it's preventing them from starting new businesses, and some businesses are very worried that they may no longer be in business. So this is a jobs bill. The other thing I'd like to comment on is the physician support for this bill. It was said earlier tonight in this chamber that physicians across the country support this bill. Well, the organizations that have been discussed at the last time I looked represent less than 20% of the physicians in the United States. In actual fact, most national special medical societies were against the bill. So this is a gross overrepresentation of national physician support for the Obamacare bill. The President had a group of physicians at the White House in white coats saying that physicians are behind this bill, but he brought in a group of physicians that are known people that are proponents of single-payer health care. So, Mr. Speaker, I would like to say again, this is a jobs bill. This will hurt jobs in America. And then the last thing I'd like to say, finishing up, related to being a physician is, what are we going to do about physician shortages in this country? This bill is going to make that worse. How can we convince young people like my son, who's a senior in high school, to go into medicine when they're looking at no significant financial way to become a primary care doctor in this country going forward with this Obamacare in place? I want young people to love medicine, to go into medicine, to keep us in a strong supply of physicians. But, Mr. Speaker, unless we do repeal this bill and replace it with things that we know that work as a private sector solution, that's not going to happen. I yield back my time. Thank you.
Mr. Speaker, I thank the gentleman for his comments and for yielding back. And before I yield again to my co-chair, Dr. Murphy, I wanted to make just a few comments as well in regard to some of the things that were said on the Democratic side of the aisle just within the last 30 minutes. The gentleman that spoke is a fine member, got a great heart, a lot of compassion. He's a friend of mine, and I don't refute him in any way of being strident or any animosity toward him. But the gentleman made a comment about, well, why not give the law a chance, I think is sort of the way it was put, Mr. Speaker. You know, the Republican majority, new Republican majority, wanted to come along with H.R. 2 and repeal the bill. Didn't even want to give it a chance to see how well it might work. Mr. Speaker, I would just say on a point like that, we on this floor right now on the Republican side of the aisle, we doctors know when you discover a cancer, you don't give it a chance to grow. You don't give it a chance to metastasize. You cut that sucker out, and you get rid of it lock, stock, and barrel, as our colleague from Indiana, I'm sorry, from Iowa, Steve King, said the other day. You pull it out by the roots. And I think, Mr. Speaker, that the Speaker, John Boehner, said the same thing. So we feel very strongly about this, about the fact that today we did the right thing. And, of course, I've got a number of other charts here that our colleagues might want to reference in regard to specifics about what we feel about this bill and why we needed to repeal it and basically start over. Just finally quickly say that also I heard the other side talk about statistics saying that only 18% of people wanted the bill completely repealed. That's not an accurate statistic. 18% wanted to leave it like it is. Fully 75% in the latest Rasmussen poll wanted it to either be repealed and replaced, or if not repealed, significantly altered. And, of course, that's what we're about as we go forward. I want to yield back to my colleague from Pennsylvania, the gentleman, Dr. Tim Murphy.
Thank you, Dr. Gingrey. A couple of the brief points I'd like to bring up here with regard to this, because out of a sense of compassion, we want to continue to practice health care, and we want patients to be able to afford it. But let me point out a couple ways that this bill is trying to fund the expanded government-run health care that actually increase costs. One is that the very thing that we should be working on to reduce costs, such as medical supplies and other practices, will be taxed. Pacemakers will be taxed. Heart monitors will be taxed. Artificial joints will be taxed. The nips and the knees and hips that people will have replaced will be taxed. Stents, diabetes supplies, prescription drugs are going to be taxed. That tax is an increase in cost of health care and something that has to be paid for, which gets paid for by increasing costs of insurance. Employers also have to pay increasing taxes if they don't have enough insurance or if they have no insurance for their employees. And if they have too much insurance for their employees, instead of rewarding them and saying, this is good that you're providing comprehensive insurance for employees, that gets taxed as well. And, of course, employees themselves, if they're not covered, they've got to pay taxes. As the way this bill works, because there's no time frame, they can get it when they're in ambulance on their way to the hospital. One other point. Part of the funding for this is to take $70 billion from a long-term health insurance plan called the Community Living Assistance Services, which is the CLASS Act. Before it even starts, they'll take $70 billion out of this over 10 years. But what happens is the premiums will need to be paid in actual claims. Actually, it is far less than it's going to be needed. Now, if any of us tried to start an insurance plan and took all the money out before it even got started, well, you wouldn't be able to get a license to provide that insurance. One of the many flaws in this program that does not have the money to pay for it, and another reason why the bill had to be repealed before it is replaced.
And I thank the gentleman for yielding back, and I realize, Mr. Speaker, our time is running short, and I want to make a couple of points in my last poster before yielding back to Dr. Brown for a final comment. Republican doctors can help the repeal, replace effort. And I've got four bullet points here that I want to point out to my colleagues. Number one, health insurance reforms, yes, but without government health plans. Number two, Guaranteed access to insurance, yes, but without an individual unconstitutional mandate. Number 3, reduce the cost of health care, yes, but without gutting Medicare, especially the Medicare Advantage program, and taking something like $130 billion out of that program. And I think it was pointed out earlier that 20% of Medicare recipients are on Medicare Advantage, or at least they were. And number 4, medical liability reform, and I will have a bill addressing that issue, the health care. Let me return to my colleague from the 10th in Georgia for final comments, Mr. Speaker.
Thank you, Dr. Gingrey. We hear from our Democratic colleagues that the budget deficit is going to be increased by repealing Obamacare, but that's just simply not true. The Democrats have used some faulty accounting techniques, deceptive accounting techniques, to show that. The actual cost, if we keep Obamacare over the next 10 years, is going to increase the deficit by over $700 billion. If we keep it, we cannot afford it. States cannot afford it. They're already suffering. My home state of Georgia has a $2 billion deficit, and the increase in Medicaid premiums that are going to be forced upon states all over this country, they can't afford to continue to do that. We can lower the cost of health care. We can maintain good quality health care so that is patient-centered, so patients can make their own decisions with their doctor. And that's exactly the kind of health care system that we're going to bring forth to this House. We're going to replace the bill, and then we'll get it through a Senate. So we're going to continue to fight for that. I yield back, Dr. Gingrey.
And I thank the gentleman for yielding. Just a few closing remarks. I want to, Mr. Speaker, I want to thank Dr. Gosar, excuse me, and Dr. Bucshon for being with us tonight. And, you know, we didn't have time to go into all the details that we would like to have gone into, but one thing is for absolute clear is governors across this state, and not just Republican governors, but Democratic governors as well, are very, very concerned with the Medicaid mandates and the fact that this maintenance of effort requirement that says the governors can't even be innovative and creative in running their own Medicaid programs. It's resulting in budget busting in all these states that have to balance their budget. Unfortunately, we don't do that up here. They're having to cut education to the bone. They're having to cut public safety to the bone because of this massive increased cost of Medicaid. Well, we thank the Speaker for the time, and we appreciate the opportunity to speak to the American people. We'll be back here tomorrow to pass House Resolution number 9 so that we can get busy on replacing Obamacare. And with that, I yield back the balance of our time.
Gentlemen, yield back. Gentleman from Georgia.
Mr. Speaker, I move that the House do now adjourn.
The question is on the motion to adjourn. Those in favor signify by saying aye. Those opposed, no. The ayes have it. The motion is agreed to. Accordingly, the House stands adjourned until 9 a.m. tomorrow.
The House today voting to repeal the health care law signed by President